want to welcome everyone to our webinar today, Top 5 Peptides You Need to Know. This evening's webinar is co-sponsored by the International Peptide Society and the American Academy of Anti-Aging Medicine. If you haven't heard, real quick, I wanted to let everybody know that A4M is doing a Black Friday sale. It's running this week from Monday to Monday. With 50% all of the educational opportunities that A4M offers. So it's a really great time if you've been considering any of the educational courses, the fellowship, any of the online education, any of the upcoming events such as the World Congress. Great time to take advantage of this 50% off sale. So I encourage you to visit A4M's website or to call your educational advisor. I also wanted to let everyone know that we are recording this webinar. We will send it out to everyone approximately 24 to 48 hours post-webinar. You'll get the on-demand replay. So if you have to leave early or you want to re-listen to something, you will get the recording. So let's get to some introductions. I want to introduce our presenter tonight, Jim LaValle. No stranger, most of you who are probably logged on know Jim. So I'm just going to go through a few highlights, some fast facts about Jim. Jim's from the great state of Ohio. I say that because I am as well. He's a graduate of the University of Cincinnati College of Pharmacy, where he served for over 16 years as an associate professor at UC College of Pharmacy. Jim also serves as a clinical instructor in the Masters of Integrative Medicine program for George Washington University. He was also awarded Faculty of the Year in 2017 for A4M. He wears several hats, very important hats with A4M. He teaches literally in every single fellowship module. He's also on the steering committee that oversees all of A4M education. And he's also now the co-chair, or actually the chair of the new launched peptide therapy certification program. So I got just a little bit more. I'm almost done here. He's the founder of the Metabolic Code Enterprise, which helps practitioners and patients identify new metabolite type through labs, subjective surveys, evaluation of drug-induced nutrient depletion, and biometrics. Jim has authored 16 ebooks and 20 books in prints, including Cracking the Metabolic Code, and his most recent, Your Blood Never Lies. He was named one of the 50 most influential pharmacists by American College Druggist magazine and was one of 9 Americans selected to serve under Senator Harkin to participate in the inaugural Dietary Supplement Education Alliance and Dietary Supplement Information Bureau. Finally, he was selected recently, and I know this is, he's very proud of this, but doesn't talk about it a lot. He was selected recently to be the Integrative Medicine Program Director for the NFL Hall of Fame and Performance Program. Was selected as that in 2019. So I'm going to turn it over to Jim. I think this is going to be a great webinar, fast-paced, and everybody's going to learn a lot. It's going to be super informative. Thanks, Jim, for being with us tonight.
Great. Thanks, Amy. And yeah, tonight we're just going to rip through, give you a little bit of introduction to some peptides if you haven't had much exposure to it, or maybe you'll pick up some value. I do want to talk about the new International Peptide Society. Is the chair of the steering committee. What I'm attempting to do is bring together a family of great doctors who can share and participate and educate those that are looking for information on peptides. My experience in writing databases and writing books that have been published for, in the medical literature, I think it's important that we create as accurate of information as we can. I just wanted to show you guys real fast the way we're doing the monographs or the education for each of the peptides, where we're really going to rely on the most accurate information possible. So for example, BPC 157, otherwise known as body protection compound, we'll go through all of the following things, sequence, molecular weight, formula, most frequent use, dosage, safety potential side effects, contraindications, description, clinical research, and the levels. What's the levels mean? Well, we'll get to that in just a minute. I'm just kind of showing you the writing that we've been putting together so that you can quickly get information on each of the peptides. We're reformatting not only the 85 monographs that was in the former library, but we're going to be writing new ones as new peptides are evolved. But here's one of the things that we're doing. We're evaluating the evidence and we're rating the level of the evidence for each of the peptides. So when you check the box, that is where a study has been performed and where the evidence is at for the individuals. So it helps us to kind of create, I think, an accurate profile of what we know about a peptide. And then we're also going to have a forum to be able to report any kind of successes, so case studies, but also if there's an adverse event. So really important. And obviously fully researched with all the references as well. And then, of course, you can get the abstract for the particular studies. There's a community. I already mentioned that. The reason for the community is simply like this. It's a directory of memberships that you can connect with and be able to have a conversation with and to really share experience. And then you can add your clinic in for practitioner search. So I just wanted to highlight that because we're really revamping it and really creating kind of a collegial effect with the society. Myself being a clinical pharmacist, I think it's important that we get these mechanisms in pharmacology down, and of course, surrounded by some fantastic physicians as well that have got extensive experience in the area. So, peptides. What's the current use? Well, the current use is everything you can think of. Everything from antimicrobial to antioxidant to anti-obesity to the gonadal axis, stimulating testosterone, regulating hormones for women, dyslipidemias, metabolic inflammation, digestion in gut, blood sugar, cognitive function, performance, ACE inhibition, coagulant activity. Virtually, you can think of every function because that's how our body works, is through the signaling of peptides. So we're identifying new ones and looking at all the peptides that are in the pipeline. And, so these, I have to shrink this thing down here, guys. Excuse me 1 second. There we go. So I can get me off of there we go. Now I can see everything. So percent use of therapeutics. So if you look for metabolic disorders, a lot of peptides now focusing, obviously, you're going to see, I think, a plethora of research on the immunologic side, hormonal diseases, infection, cardiac. I mean, as you can tell, 2016, there's a pretty across the board coverage of peptides. So why we came here tonight, the top 5 peptides to consider, but I put a list together of the other ones that you should know. I actually even did an extra 1 or 2 here. So even though it's the top 5, you're going to get a bonus. So these are the 5 that I think are commonly used. I'd also say that I asked different practitioners that are on our steering committee what they use. And so I added the other ones because that incorporates all of the top peptides that they recommend. So CJC with Ipamorelin, probably by far the most important or the one that's utilized the most. Thymulin, a thymic peptide. ABP7, MOTS-C, mitochondrial-derived peptide, BPC-157. And then, of course, the other ones like kisspeptin, epitalin, PT-141, GHK-Cu, KPV, CMAX, Celanc, all different peptides that, especially if you come to the course, you get to learn about all these and how they're applied from our different experts on the panels. So CJC-1295 is with or without DAC. Usually you see it without DAC. What is DAC? DAC just increases the half-life of it. It's a growth hormone releasing factor. I use this a lot. I'll tell you, I have a case just literally 2 weeks ago, now 3 weeks ago now. 62-year-old, was on growth hormone, really wasn't getting that great of results. Now, I'm going to give you an opinion of that. He was still drinking too much alcohol and eating the wrong foods. So, if we're expecting to inject things and not help people live better lifestyles and clean up their metabolic disturbances, you're just not going to get the same benefit. So getting people to, adopt a lifestyle that will allow these peptides to work, I think is key. And we talk a lot about that actually in the first module, as we talked about, in the first part of the certification course. So you can get a measurable concentration after 10 to 13 days. 90% of it's bound to serum albumin. And it seems to be able to elevate growth hormone for several days after a single dose. That's Journal of Clinical Endocrinology back in 2006. And so in my gentleman, he was already weaning down off of his growth hormone. He wasn't that thrilled with it. We started him here. I explained to him that this is going to help him to release his own growth hormone. We changed his diet up, got him on. He also was in need of some testosterone. And 3.5 weeks later, he's down 11 pounds and he feels great. His energy's back. His stamina is good. And I'm sure that this is just starting to work on him now. But it's going to take a period of, 6 weeks before he really feels the difference. What are the uses for Ipamorelin and CJC? Physical performance, caution. If you're a WADA trained athlete, if you have a patient that's an athlete that's being tested, you cannot use Ipamorelin with CJC-1295. It's banned. So, if I'm an amateur, I'm just like in a train to perform, I'm training because I want my body composition better, I'm training and I'm, wanting to age more gracefully, I'm doing yoga, I'm doing Pilates, I'm, whatever it is. Now, if that is okay. It absolutely, if you're using it for weight loss support, typically the dose will be, twice a day, 5 to 10 units. It's a thermogenic. It definitely helps lean people out. As I said, this latest case of this 62-year-old is a prime example. Improving recovery from exercise and injury has been shown to increase bone density, improves sex drive. I think part of the improvement in sex drive is because if it's not just sex hormones that are dipping, if your cortisol levels are high and you shut down your testosterone and you shut down your growth hormone releasing hormone, this really helps to reset the HPA axis that's been stressed under allostatic load. It does have neuroprotective benefit. I would say that there are probably peptides that are directly effective for neuroprotective benefit, but this has some neuroprotection, and it also has some improvement in cognition and memory. Ipamorelin is a third generation growth hormone releasing peptide. It's a ghrelin growth hormone secretagogue, so it doesn't raise any other hormones. So cortisol, prolactin, or ghrelin doesn't go up. CJC-1295 is an amplifier of the growth hormone releasing hormone. And then Ipamorelin is for ghrelin. And the combo provides pulses of growth hormone and increases the number of secreting growth hormone cells. So it helps to make your body release the growth hormone that you're making. So if you look here, as you can see, you have the growth hormone secretagogue, Ipamorelin, and then which is upregulating ghrelin. And then you've got the growth hormone releasing hormone that is helping to induce growth hormone release. So both of these are working together, acting on the pituitary to improve your natural growth hormone release instead of an exogenous source. 2006 study, IGF levels increased within 8 hours post-injection. Now, I'm just going to say, even though they showed this, everybody I've talked to said they stopped measuring IGF-1 levels because it's so spotty on when you can, when you get them, because they're so fleeting. So even though I know in the studies it showed IGF-1, I just haven't talked to practitioners who are using IGF-1 as a guidepost to the administration of their Ipamorelin and CJC. And this is just kind of more of that growth hormone release with Ipamorelin and CJC. And of course, CJC-1295, I think, which is really interesting. There's a lot of people who will take their Ipamorelin and CJC at bedtime, which is typically where that'll be the first, like if you're doing one dose a day, you do that. And that's reported to promote REM sleep and slow wave sleep independent of age. So this is great. So in people that are, above the age of 60, all of a sudden they're sleeping better and sleeping deeper. You also get better retention of muscle. And when it says inhibits cortisol release, as I said earlier, it's more about regulation of allostasis for normal diurnal patterning of cortisol. So, if you've got people with flattened cortisol curves, most of the time you'll see that, oh my gosh, they're gaining weight, they're gaining fat, their energy's down. They start on something like Ipamorelin and CJC, and then they start to notice that their energy's coming around and they're leaning out. Dosing, I would say, check with, depending on what the concentrations are, check with your compounding pharmacy, but typically it's 5 units to 1 unit at bedtime, 5 days a week. There are some folks that'll do it twice a day for body composition, meaning that they just want to lean out more. They'll do it in the morning and at night. Ideally, what you'll do is that you'll be on an empty stomach for at least 30 minutes after. Ideally, it'll be a high protein, food after you take it in. So carbs will inhibit it, fat inhibits it. So just, what I tell people is don't eat anything for a good 30 to 45 minutes after you do your injection. There is the thought that it might be mitogenic. So if they have cancer, I would be careful. And then GH could mask the symptoms of hypothyroidism. So just check your thyroid hormone levels. Probably by far the number one thing that we get questions about is the use of Ipamorelin and CJC-1295. And it doesn't seem to disappoint. People do really well on it. Thymulin, if you remember right, the thymosin alpha and thymosin beta are now kind of by the wayside now per FDA. So Thymulin extract is a immune modulator. So this is a thymic factor. It's zinc dependent. It also helps to stimulate release of growth hormone and luteinizing hormone, a little bit of prolactin, not a lot. But prolactin can also stimulate thymulin synthesis and secretion. Typically, where you'll see thymulin applied is in immunodeficiency or low people that have worn their immune systems down and getting a lot of colds and flus, or in autoimmune disorders. So if you look at it, and if you're, when I think of metabolic inflammation or metaflammation, one of the key characteristics of it is that, people are in sympathetic overdrive, so they lose their allostatic balance. And when their central nervous system is upregulated significantly, it starts to put pressure on the immune system, right? So it acts as an anti-inflammatory through regulation or counter-regulation of chronic inflammation signaling. And what that does is that helps the central nervous system to kind of come back in balance, because if you have a sympathetic dominance, parasympathetic tone is low, that's going to trigger pro-inflammatory chemistry. So if we can get that modulating effect, if you're going to use a nutrient with this, you'd use something like Moducare, right? Because Moducare, plant sterol, a known immunomodulator. So if you're really working at trying to immunomodulate someone, Thymulin extract plus, something like Moducare makes a lot of sense. Because remember, once you're out of allostasis, you start to push towards inflammatory chemistry and you start to lose the vigilance of your T killer cells. So it supports that balance of Th1 and 2. It helps differentiation of T cells. So it's helping to mature T cells and helps to prevent overproduction of inflammatory cytokines. So it's, an interesting compound, right? Especially today. And the more we are finding out about metabolic inflammation and inflammaging, we know that, it's key for us to try to push back that chronic cycle of inflammation. We know people are supposed to have an inflammation response. It's just supposed to get turned off. When it doesn't get turned off, it creates everything from anemias to dyslipidemias to insulin resistance to mitochondrial disruption to loss of neuroplasticity. So it acts directly on the nerve terminals through prostaglandin E2. Why is that important? That's going to help to regulate thromboxanes. Studies in the 80s showed that it was used in rheumatoid arthritis, multiple sclerosis, nephrotic syndromes, immunodeficiencies, lupus. So interesting. And this was a great Journal of Advanced Healthcare Research, 2020, Thymulin, a hope out of the box in the COVID-19 disaster. So think about all your folks that they're chronically in an inflamed state. Maybe even think about if you're working with a lot of Sears patients and, their MMP9 is elevated, their TGF beta 1's elevated, they got high anti-cardiolipin antibodies. Think of this as something that's like putting a wet blanket on a fire, right? But it's going to keep that immune system still able to respond. This was a 1987 study. I know this is an old study, but it goes to show you that these peptides have been studied for a long time. This was a double-blind randomized placebo-controlled trials, 2 of them on nonathymulin for rheumatoid arthritis, dosing 1, 5, and 10 milligrams a day subcutaneous for 6 months. Significant clinical improvement is evaluated by the global assessment of all patients who entered the trials. T-cell improvement. The 5 milligram dose seemed to be the most efficacious. 2 patients had side effects at receiving 5 milligrams daily. 1 had a peripheral thrombocytopenia at 3 months. 1 patient vasculitis at 5. Some malaise and pain at the injection site. But in general, significant clinical improvement in the study of basically 79 patients. Short half-life, 30 to 60 minutes, but it has a longer duration on its effect on T lymphocytes. So, even though it goes in and, has a half-life of 30 to 60 minutes, you get about 24 to 48 hours effect on T lymphocytes. And, you want to think that, your T lymphocytes is ready to be active, right? Dosing on Thymulin, sub-Q daily for 2 weeks and 1 milligram 3 times weekly for 4 months. You can increase the dose up to 5 milligram as needed on your clinical judgment. No real documented side effects have been seen other than in that study. So pretty interesting. This has kind of gained a lot of popularity now with the advent of the removal of thymosin alpha-1 and TB4. AB7 is the next peptide. And, guys, I picked, because it's cold and flu season, I picked a couple of top 5 peptides you need to know that were, immune friendly. This is a fragment of thymosin beta 4. I believe it's 7. It's a 7 amino acid sequence. It supports immune function. It has some antimicrobial activity. It does improve T cell maturation. You could use it with Thymulin. It helps with modulation of the mucosal immune system. So all your folks that you're having trouble with their gut reactivity because they got gut permeability problems and you don't seem to be able to get them over the hump, think of AB7. It's nephroprotective. And I got to tell you, I'm dealing with more and more people with GFRs in the 50s and low 60s when they're 50 years old. So and of course, the big aspect of that is oxidative stress. But important to keep in mind, anything you can do that can protect the kidneys. It helps decrease scar tissue formation, reduces level of myofibroblasts, and it's neuroprotective. Scar tissue as well, the fibrosis, think of it not just for cardiac, but also for kidneys and for liver. For the summary of AB7, this was a New York Academy of Science 2007. So hair growth, stem cells, regulating VEGF, because in a lot of your SIRS patients, I had one the other day, their VEGFs are very low. So when they're very low, it shows the immune system's really been compromised. When it's really high, then you know it's in a very inflammatory state, right? And we actually are doing a lab talk during the at the conference in December, all on these types of findings, so that you can find your way through, when do I want to use this peptide or that peptide? It helps to regulate metalloproteinases, TGF-beta, decreases NF-kappa B, and the big one of decreasing endotoxin lethality. So important, because what they're finding out is circulating endotoxin, and basically the death of bacteria in the gut, the cell wall then breaks down and circulates circulating endotoxin, is that every cell in your body's got lipopolysaccharide receptors, and you can really create an inflammatory storm. So reducing the endotoxin load is incredibly important. And of course, this downregulates a lot of the common inflammatory cytokines and compounds, and that were tracked towards disease states and conditions. So where's the applications? And so immune support, of course, soft tissue repair. Think of kidney support, venous stasis ulcers, conditions requiring immune modulation. I find that a lot. I think especially today, with everything going on with COVID long haulers and people really just not rebounding, they seem to have kind of a chronic inflammatory response. I think this could be really beneficial. Dosage, 300 micrograms to up to 1 gram sub-Q. That's 1 milligram sub-Q, sorry. Depending on presentation, you don't dose it for more than 3 months. You can go on 3 months, off 1 month. You could use it with BPC concurrently for healing the gut if you want. AB7 is banned by WADA. So just keep that in mind. Before you apply any peptide to a patient, look at the WADA rules, because they do test for them. I've had athletes that have come to me that were already, dinged for it. And we have obviously had to clean them up. This is after, not from me giving peptides to them, but from other practitioners. And they think that because it's got a short half-life that you can't pick it up. But the problem is there's metabolites. So they've got intelligence with the testing to pick up peptides. Now, this is probably, if I had to say what my favorite peptide is, it's MOTSc, mitochondrial-derived protein. It's an age-related mitokine, so it's released as a response to cellular stress, and its purpose is to preserve mitochondrial function and then improve cell viability under stress. So why do I like this so much? Because with metabolic inflammation or metaflammation, one of the endpoints is mitophagy. You lose mitochondrial function, you lose mitochondria. So all the pre-diabetics and diabetics that don't have energy and are gaining weight, and they're laying fat down in their muscle, you can think of MOTS-C as a really good option. And I mean, I've yet to have somebody not respond positively to this to improve their energy, their mitochondrial output, and help their blood sugars. I mean, I've got people that we've put on MOTS-C that they've went from an 8.1 A1C to a 6.2 A1C. And these were people that were fairly well managed when they first came to us. I mean, they were already doing kind of anti-aging, integrative strategies. So it can really have a big impact. And then, of course, increasing cellular NAD. You could do NAD subcutaneous, right? You could add 50 milligrams of NAD subcutaneous to this. Suppresses inflammatory cytokines. So once again, to me, this is the superstar for people that are in that meta-inflammatory state where, they're at the cellular level have broken down their energy capacity. So it really does target metaflammation and metabolic signaling issues and anti-aging. Metabolic signaling issues are simple. More mitochondria, the more efficient the cell is. The more NAD, the more energetics the cell has. And then, what else can it do? Regulating nuclear genes related to metabolism and proteostasis, helps with skeletal muscle metabolism, and helps with myoblast adaptation under metabolic stress. And a lot of people under metabolic stress these days. These are brand new studies, by the way. This is a 2001 study on MOTS-C as an exercise-induced mitochondrial encoded regulator of age-dependent physical decline and muscle homeostasis in Nature. So brand new, but that's kind of what we'll be posting within the Peptide Society site, is all of these types of things. So once again, just to kind of beat the dead horse, is that with MOTS-C, we upregulate the ability to efficiently burn sugars, we oxidize fats, and we create mitochondrial biogenesis. So for your folks that are, pre-diabetics, diabetics, people with SIRS, if you listen to Dr. Heyman's talks, he talks about how they turn into GLUT1 transport patients, meaning that they're no longer utilizing aerobic glycolysis. So it's really, I think this is one of the more important peptides. Dosage 10 milligrams 3 times a week for 4 weeks. I mean, honestly, that's in some of the clinical literature. For me, what we have done is 5 milligrams twice a week or 10 milligrams once a week. I haven't had anybody where they've had adverse events yet. I mean, I'm sure somebody will come up with a rash somewhere. Redness and pain at site of injection could happen. You may see depletion of folic acid from the use of MOTS-C. So you should at least check homocysteine levels, check folate levels. That'd be a good way to just kind of monitor this. And then, of course, add folinic or 5-MTHF up to 1,200 mics a daily should take care of it if you're prone to it. I haven't seen this yet, but it's in the literature. Next is BPC-157, another one that I can't tell you how many people have benefited from this over the last 4 years of learning about BPC-157, both orally and subcutaneously, and now even topically on wounds, right? Known as body protection compound. It's derived from human gastric juice. It's a gut immune brain axis remedy. It has anti-inflammatory effects, supports the mucosal lining. I'll bet many of you that have given BPC-157 capsules to people for their gut health, you've seen some improvement in them. Is it in everyone? No, but in most people, they definitely notice a difference. That they're not having as many GI symptoms, they're not as bloated, they're not feeling as acidic, they're not having reactions as much. So it really helps to heal gut mucosa. It downregulates inflammatory cytokine signaling. Now, look, you'll have somebody say, "Well, I thought inflammation was great after training." It is, but you have to remember the person's supposed to recover. So if they don't recover, then that means they're overtrained and they're going to be in a chronic inflammatory signaling event. And then improves cell survival under oxidative stress, and then decreases neuroinflammation. So you do see people in protocols using BPC-157 for improving cognition and helping to restore neuronal budding or dendritic pruning. Helps with wound healing. You can obviously put this topically on a wound. Helps with bone repair. Supports nitric oxide, although I think I'd probably use some other things other than that. And then helps with VEGF. So once again, VEGF downregulated in your chronic inflammation response syndrome cases. And we've kind of already went through these. Is it's improving granulation so that people heal from their wounds quicker. A lot of tears or strains or inflammation, connective tissue, fantastic. And I already went through kind of the gut piece. By improving nitric oxide, you actually end up improving healing in the gut. So it does act as kind of an anti-ulcer agent. That's why I give arginine when people have ulcers, right? I'm trying to improve nitric oxide release. And you could use beet now, whether you decide to use, eat any of the beet products, but Beverly Life, for example. In lab studies, it's been effective in ulcerative colitis, decreases NSAID and alcohol gastric side effects. So if you got people who are on a fair amount of NSAIDs, think about one BPC capsule a day, 500 micrograms, maybe 5 days a week. And the arginate is the BPC that is considered to be the most effective. So if you're doing this, typically you'll see 300 micrograms once or twice a day in order to heal an area. You may inject it close to the injury as possible subcutaneously. You can also just inject it for general support. And in some cases, use for 2 to 4 weeks. You can cease for a week or two and then restart as needed. But in many situations, we see great improvement over 4 weeks when people utilize BPC. It's once again, even though it's angiomodulatory, we got to, because these cautions are out there, theoretically used with caution in conditions where angiogenesis might be a problem, like tumors. Although it's an immunomodulator, it is an angiomodulator. Copper peptides. So we got a little bit for everyone. BPC, connective tissue, gut health, Thymulin, AB7, immune regulation, and supporting just general immune function in addition to immunomodulatory effects. The Ipamorelin, CJC in terms of release of growth hormone, and then now so copper peptides like GHK, so GHK-Cu. Used in skincare. I think that in module 2, you will see a hyaluronic acid bonded to GHK-Cu that will be used in the demos for the skin, for improving collagen synthesis in the skin. So that's brand new. Hyaluronic acid and copper peptide for injection. Interesting, right? So it's a part of the cytochrome C oxidase and SOD system. A lot of people don't think of copper as something for the immune system, but it's really important for viruses and managing fungus. And it's also important in order to activate SOD, which everybody's so focused on glutathione. We forget about that catalase and SOD are really important antioxidants that you need as well in order to reduce oxidative burden. So, GHK with and without copper affects a bunch of different genes related to the response to injury. So it helps with tissue remodeling. It has antioxidant and anti-inflammatory effects. Anti-anxiety, I haven't seen a lot of anti-anxiety effects from GHK-Cu, but helps with nerve outgrowth. Does seem to have some anti-cancer action. And then, of course, blood vessel growth. So this is just rejuvenation of, the endothelium, the cartilage and ligaments and collagen. And of course, what breaks down your blood vessels? Collagenase, right? So using GHK-Cu will help to reduce that metabolic effect of collagenase on collagen tissues. Anything important here? Yeah, supports, once again, helping the gut lining. It's used a lot, and you're going to see another presenter in module 2, if you do it, demonstrating. So we've got somebody demonstrating face use of peptides and related compounds. And then we've also got Dr. Joe Cleaver and Dr. Mercado teaching on the use of peptides for hair. So GHK-Cu used a lot, can be used topically as well as when they're doing their microneedling. Accelerates wound healing, helps with collagen deposition. So you can think of any time after someone's surgery, it can really help in terms of healing tissues. And helps with an appropriate inflammation response and improving collagen deposition. Trying to think if there's anything else here that's really important. The cognitive and neuroprotective effects. I'm a big believer in copper, GHK for that. And then the summary on skin and wound. I think I've went through all these already, but helps with crepey skin and aging skin. Helps to prepare skin barrier proteins, improve skin firmness and elasticity. I mean, I think people that are in for a treat when they see the injections in the face and almost how much different someone looks relatively quickly. Reduces fine lines, depth of wrinkles, smooths rough skin, helps to reduce photo damage, pigmentation, skin spots, just overall skin appearance. And then the big one, of course, I think is stimulating wound healing. So if, for me, I got a lot of athletes and that makes sense. And then, of course, it's used for enlarging hair follicle size and improving hair growth. So in this was with LED light. There was an increase in skin cell viability, an increase in fibroblast growth factor, 70% increase in collagen synthesis when used with LED lights. So if you think of photoiridation, like the red light, blue light effect with GHK, actually stimulated collagen. Already went through this. This was a 12-week program in 71 women. And what they showed was it improved skin density, thickness, reduced laxity, improved clarity, reduced fine lines and wrinkles. This was way back in 2002, American Academy of Dermatology. Kind of went through this already. Where might the other uses be that have been at least been suggested in the literature for transplanted skin and hair outcomes? Lung COPD and acute lung injury, and reported to be effective in healing diabetic ulceration. So these are big, really, really big categories where it can be a benefit. For hair growth, topically, it's 0.05 to 0.15%. It's made in gels, foams, creams, nanoparticles, you name it. They'll microneedle it. You apply it topically. Typically, that'll be 1.5 milligrams. That'll be about 10 units. I usually do it. We have people do it sub-Q. Does sting a little bit. Copper is one of those ones that'll hurt a little bit the following day. So I promised you 5, and I think I gave you 6. So I'll look at our questions. My interest is in creating a CKD peptide guideline. Your kidney sense is fantastic. Oh, there we go. Can you connect? Yeah, sure. Robin, I'll be glad to connect with you on this, because if anybody's been listening to me talk for a long time, you guys know how passionate I am about trying to spare people's kidneys. How long can you use it? So it's different. I mean, we go through pretty significant dosing guidelines, but in many instances, we'll have people take these for several months at a time. And then can you talk about the difference? Can you talk about the difference between Thymulin and taking Thymosclan? Well, the only difference is you're getting first pass effect. I mean, I do both. I love Thymosclan extract, especially if it's freeze-dried, lyophilized. I mean, you get active transport of peptides through the GI tract, but you do get a little bit of a boost, an extra fragment with using the Thymulin. So I wouldn't call it either or. I would say that it would be more an additive effect. Snowy tan. What are your thoughts about orally active peptides compounding pharmacies are selling into California? Wow, great question. I think that we're finding out more and more that some of the peptides are orally active. And then there are some innovations like nanoparticleized, liposphered peptides that I think are going to be coming on the market. So you're going to be able to deliver, I think, more and more of these peptides for the ability to use them. So I do think it's going to happen. I'm seeing a lot of interesting things on the nanotization front and kind of pharmaceutical side, in the pharmaceutical science side. I mean, any of the BPCs, manufacturers of BPC are doing a good job. So reach out to the compounding pharmacies, see if they're using the arginates, because that's the one that's really good. And then you can also get the BPC is being sold. There's different ways you can get BPC orally now, and it's quality. Can you use BPC without taking a break? I mean, you can. I would say that hopefully you're healing somebody with it and they don't need to be on it for a long period of time. I'd give them a break. There's another peptide called KPV that you can use with BPC or use it to alternate with BPC. And that works really well. The difference between Thymulin and thymosin alpha-1 are the peptides, the thymic peptides. So they're not exactly the same. Aware of a troche formula of CJC-Ipamorelin. Any experience with that? I do not have any experience with the troche of Ipamorelin and CJC, so I cannot provide you any insight to that clinically. And then, you think of early dementia patients, would AB7 be of benefit? I'd say, yeah, probably. And then, but you gotta try it and see how you do. The other one I would say is, obviously we didn't get to talk about them tonight, but Cmax and Cellline could be also very good with that as well. Please remind us how to access peptide monographs you mentioned at the start. Never mind, Amy, you got that covered. Well,
I do.
So I was kind of, what are the age ranges you see for peptides? Well, look, there are some docs that will apply these at younger and younger ages. When I presented for you today, adults. How long should patients be on sermorelin? I mean, if they're older patients, and your goal is for them to help secrete growth hormone as they're aging, right? I just like rotating it. So if I use sermorelin, then I'll flip to ipamorelin, then I'll give them a break for a period of a month to a month and a half, then I'll get them back on. It just depends if they're feeling great. If they're feeling great, it's basically, as people get older, they don't release growth hormone as well. And you're just helping them to release their growth hormone. What is the source of peptides? I am new to peptides. Well, peptides are manufactured. So peptides are amino acids that get combined to create a bioequivalent of what's made in your body, because your body makes peptides. I think I got all the answers. Would you recommend BPC for migraines? I would probably try Kisspeptin for migraines, because Kisspeptin is really good, especially if it's in a woman, at helping to normalize hormonal signaling. Not as much. I mean, I wouldn't think of BPC for migraines. I think I got them all.
I do. I think you got them all too.
Great questions. Fantastic. Well, I hope I piqued your guys' interest in peptides. Amy told me to shoot it from the fire hose, the top 5 peptides. And we could have kept going, but then I couldn't entice you to come to the peptide conference. And here, let me type this answer here.
Okay.
Got it. Oh, dihexa for cognition? Absolutely. Love dihexa. Just need to know peptide for weight loss and where to buy it from. Well, if you're going to people are asking, Amy, you mind if I answer a couple more?
Yeah, sure. Go ahead. I'm fine.
Thanks. I'll tell you what's really hot for weight loss. Now, MOTS-C, 5 milligrams twice a week, 5 milligrams twice a week. Okay. And using AOD 9064. AOD is a growth hormone fragment peptide, 25 units twice a day. And then put them on, obviously, the right diet, right? They've got to eat. And you will see an amazing weight loss. It really does help I put people on modified low carb diets and put them on low lectin diets. So we get them off gluten, get off of dairy. Don't have them eat grains the first 4 weeks and allow them a serving if they're starving after that. And we dial them in. They lose weight. So MOTS-C, 5 milligrams twice a week, AOD 9064, 25 units twice a day. Do you need to follow any specific labs while on those? Well, I would do, if I'm doing weight loss and you're really trying to get people that they'll lose weight relatively quick, you're just going to watch for, liver enzymes and kidney function and just the traditional things you do for weight loss. But it's not like medical weight loss where you're using a stimulant, right? But I would just track, like what we do is we do a very comprehensive lab workup at the very beginning. I'll use our metabolic code platform and print that report out, and then we track them 8 weeks later and make sure we're checking them. But there's nothing that you would worry about with those two. I got that. And could GHK-Cu be used for post-COVID hair loss? Yes, absolutely. Think about using the foam. Get one of the compounding pharmacies to make the foam. How many peptides can you combine together? Boy, now you're asking the big questions. Here's what I would say. I'm not a big fan. Like, there are people that, like, I just had a person came to me, Parkinsonism. All right. And he went to a practitioner who was using peptides, and had the practitioner, all they did was use peptides, and they put 10 peptides, this person on 10 different peptides. They're injecting 3 times a day. I typically don't think of doing more than 3 or maybe a 4th at a time, depending on what the case is. So I tend to, and plus they're pricey. So depending on whether it's somebody who can afford it, or I'm trying to choose the best things for them. So I usually go with 2 or 3, maybe 4. I think people get burned out when you start asking them to inject 5 or 6, 3 times a day, or 1 in the morning, 1 in the afternoon, different one at night. They get burned out on all the sub-Q injections. And somebody asked, how long does it take for the CJC and Ipamorelin to work? People start feeling better on it within a week or 2, man. They start sleeping better. And then all of a sudden they start noticing their body comp starts to change a bit. It works out really well. I think I got them all now.
I do. I think you got them all too.
Yeah.
So I want to thank everybody for being with us, and thank you, Jim. And just real quick, I know one of the questions asked, if you're interested in becoming a member of the International Peptide Society, you can do that through the peptidesociety.org website. Membership is $495. You can use the code A4MNEW and receive a $100 discount. And you would have access to the monograph library, the community forum that we have. As Jim said, we want to collect successful patient outcomes. That will all be done through the member site. In addition, I just want to remind everybody, as I did at the opening, A4M is having a Black Friday sale going from this past Monday to next Monday. 50% off all educational offerings. So if you've been considering doing any of the great courses that A4M offers, this is a great time to take advantage and pull the trigger and register for the course that you're interested in. And obviously, we would love to see you come through the peptide certification peptide therapy certification course as well, which module 1 is offered online, and we've got module 2 coming up live in December in Las Vegas. During the World Congress event that A4M is offering. So again,
and Amy, one more thing, guys, the monographs, we've rewritten them completely. We have 13, and we're going to be adding them every month. So you're going to really have an amazing resource. I mean, as many of you know, I've written database and textbooks for Lexicomp. It's that level of commitment. So, I'm back to doing editor-in-chief work. I do not think it'll be invaluable if you're doing peptides as a source of information for you. And it's because of my crew. It's not all Jim. It's our crew and our team effort that's doing it.
Yeah, Jim has an amazing group of scientific writers that are doing just an awesome job in helping us rewrite this library. And it's very comprehensive. One of the questions that came in, Teresa, A4M is managing the International Peptide Society. We began doing that as of August of 2021. If you were a previous member, you probably saw that the society was, there was no activity for a good 18 months. And we had an opportunity to begin managing it and took that opportunity. And with that comes rebuilding a lot of the content, which is what Jim and his team have been working so diligently on. But we're excited because we realize how valuable of information it's going to be for all of you when we get that monograph library fully up and running. But, and again, the community forum is a great place for all of you to mentor each other. Our steering committee will be active on there to help as well, but we really want to build this community to mentor each other and to share each other's problems, cases, and success stories with your patients.
Absolutely. We're excited.
Yep, we are. So hopefully we'll see a lot of you in December.
All right.
All right.
Hope
Thanks,
to see everybody. Yep. Everyone have a pleasant evening.